Hey, everybody, we're going to give everybody just a few minutes to get into the webinar room. I'm really excited to have you here. Today's webinar will be focused on EFT, the emotional freedom technique for wellness and counseling professionals. For those that don't know me yet, my name is Dr. John Michael Salvato. I'll tell you just a little bit about myself as we get underway, but I also want to point out to you that we're using a slightly different technology to present the webinar today, and I've had my eyes dilated for an unforeseen medical problem. As a result, my eyes are so blurry right now, I can't really see the screen. And so it may take me a moment or two to fumble around to hit the navigation buttons. But what we're going to talk about in today's webinar is going to be to help you better understand the emotional freedom technique and understand its basic principles. You'll be able to identify the key components of an EFT session, what we call the basic recipe. And you'll be able to demonstrate basic EFT tapping techniques to your patients and your clients and apply these techniques to a variety of wellness, health, and counseling issues in your practice. So I'm going to start out by, for those who don't know me, I'll try to keep this brief. I'm a naturopathic practitioner and research scientist, naturopathic physician for 19 years. I hold a PhD as well in theological anthropology, a master's in counseling, and I've actively been using evidence-based clinical EFT in my personal counseling practice since 2004. The predominant focus of my practice has been on survivors of religious trauma and sexual assault, gender dysphoria, LGBTQ plus issues, and substance abuse and recovery issues. But I've used this on a number of other clients and patients who needed some type of relief that we weren't going to get through traditional counseling. So I'm excited today to be able to talk with you about the emotional freedom technique, or EFT. EFT is a simple and powerful technique that can be used to address a wide range of physical and emotional issues. It's a mind-body healing technique that combines elements of cognitive therapy and acupressure. It's based on the idea that our emotions are connected to an energy system within the body. Many of you might be familiar with this concept from acupuncture and acupressure practices or Reiki. But when we experience negative emotions such as anxiety and trauma or stress, it creates blockages in our body's energetic system, and that then can transfer to neurological energy systems, neurological systems, and physical system breakdown. It can elevate our cortisol levels, which then causes inflammation in the body and triggers a cavalcade of problems when left untreated. EFT uses gentle tapping on specific points in the body to release those blockages and restore balance to the body's energy system. So let's talk a little bit about how it works. When we tap on EFT points, we're sending signals to the brain to help calm the amygdala, that part of the brain that's responsible for our fight or flight response. Tapping also helps increase the production of endorphins, which have a mood boosting and pain relieving effect. And it's been clinically proven to reduce cortisol levels in the body, which again reduces inflammation, reduces stress, does less telomeric damage than high cortisol levels. And so as a result, EFT can be used to address, as I said, a wide range of emotional and physical issues, including anxiety and depression, stress, trauma, pain, weight loss, smoking cessation, performance enhancement for athletes and for educators, or really performance enhancement in every aspect of your life, and so much more. Now, the reason we're doing this free workshop is because I felt it was time, particularly with what's going on in our world, for wellness professionals and counselors to take a look at EFT because it's a particularly valuable tool for wellness professionals and for mental health professionals because it's non-invasive. It's an easy to learn and easy to employ technique that can be used to help clients address a wide range of issues. EFT can be used to help clients to develop better self-empowerment and coping mechanisms, a greater sense of resilience. And so we're going to talk to you within the context of this course about the basics of EFT and how it works. We're going to introduce you to the tapping technique. We're going to show you how to apply this EFT technique in a variety of wellness and counseling issues. And we'll talk a little bit at the end about clinical applications of EFT and ethical considerations that we encourage you to do. I'm confident that by the end of this course, you'll be able to see that there is value for you to employ EFT with some of your clients and give them an added advantage to be able to start healing, to be able to begin the process of reclaiming their power and releasing those blockages in their body's energy systems. Okay, so in this next section, we're going to talk about it, and I hope you can see the screen in front of you. We're going to talk about the basic EFT tapping technique, as well as some variations on the technique. So the basic technique involves tapping on specific points on the body in a specific sequence. So you'll hear me refer to these throughout the presentation. The first is what we call the karate chop point. So when you're making a karate chop, that place that hits the target, we call that the karate chop point. The top of the head, the top of the brow, the side of the eye, under the nose, the chin, the collarbone, and under the arm, about the place where a woman's bra strap would hit. Now, some practitioners also like to end with the solar plexus. I don't happen to use that, but that is a variation that I've seen a number of practitioners and talked to a number of practitioners who do. So what you're going to do is, in order to employ this technique, you tap on each point using your fingertips. You can use two fingertips from your dominant hand and tap on the non-dominant hand for the karate chop. And you're going to tap lightly but firmly 7 to 10 times. And as you tap, you're going to focus on the issue or emotion that you're working on. So let's run through the tapping sequence first. And let's just begin by taking a couple slow, mindful breaths. And let's know that we have tools within our hands to allow us to release whatever it is that's creating a block, whether that block be energetic, whether that block be psychological, whether that block be an emotional block or a physical block in the body. And so we're going to begin by tapping on the karate chop point. And we're going to say, even though I have, and then you would insert the issue or the emotion that you're working on, I deeply and completely accept myself. Then the top of the head, this issue or emotion is just a feeling. On the top of the brow, we're going to say, I choose to let go of this issue or emotion. Now, you're going to include in your statement, in your practice, actually addressing whatever it is that you're trying to change. So then the top of the brow, the side of the eye, I am safe. Under the nose, I am loved. On the chin, I am enough. On the collarbone, I am worthy. And under the arm, I forgive myself. Now, there are variations on this technique. We're going to talk about some specific applications in the sort of lead up to the diving in. But one of those variations is the use of a setup statement. And a setup statement is a brief statement that describes the issue that you're working on with the stated objective. So you can clearly say, as I did in the beginning of our session, that in the beginning of the demonstration, that this is a tool within my power to employ to release whatever blockages, whether they be physical or emotional or energetic, that might be preventing me from living my best life, or from your client living their best life. So that's one option that you've got. There's also a variation that uses a reminder phrase that can be anything you want, really. It's just something that helps you stay focused on the issue or emotion that you're working on. And then a very popular variation is to use a reversal statement. And reversal statements are something that you use after you've tapped on all 9 points. And in the reversal statement, you're going to use another technique that we talk about in the advanced course, with a reversal, or a positive outcome statement. So the setup statement, for example, could be, even though I feel anxious, I deeply and completely accept myself. The reminder phrase might be, I am safe and relaxed. And the reversal statement might be, I release any anxiety and I'm calm and relaxed, or I feel peace and ease in everything that I do. So let's use an example of that, and we'll start on the karate chop point, and we'll say, even though I feel anxious, I am deeply and completely relaxed and accept myself. Then the top of the head, this anxiety is just a feeling. The brow, I choose to let go of this anxiety. Now the side of the eye, I am safe. Under the nose, I am loved. The chin, I am enough. The collarbone, I am worthy. Under the arm, I forgive myself for feeling anxious. And then take a deep breath and let it out. Okay, what's really important at this point isn't that you completely understand the process or that your client understand the process, but just to sort of check in. So if some of you were feeling a little bit of anxiety before we got started, I ask you now, where's your anxiety now? Where do you feel? Did you feel when you took those breaths, the shoulders drop a little bit? Maybe the tension in your neck or in your jaw relax a little bit. So you can experiment with different tapping sequences and variations to find what works best for you. But the important thing is to be consistent with your tapping practice. And so we could employ other variations at this point in between. One that I often do at the very beginning, that I failed to mention, is to go to the place where we call the tender spot. And you'll know when you hit it. It's a place where we stimulate lymphatic drainage. And it's about, if you go to the edge of the collarbone and you come down about 3 inches, it's right about there, right? And it's tender. You'll feel it. And so I may do my opening statements during this point, or I may just breathe in and just let myself recognize and acknowledge where we'll say we're treating for anxiety, where my anxiety is at that level, and then take a few more cleansing breaths. I recommend that you focus on a specific issue or emotion that you want to address. Don't be too broad. Be honest with yourself about how you're feeling. So you set up a positive setup statement in the beginning and a reminder phrase in order to help keep you focused. You tap on each point firmly but gently for about 7 to 10 times, as I said. You take your time and focus on your breath as you tap. And if you find yourself getting distracted, it's not a problem. Or if your client gets distracted, it's not a problem. Just begin again. This is a powerful tool that allows you, when you use it on a regular basis, to learn to manage your emotions more effectively, to give you aha moments that might otherwise be missed because of your distraction with the pain or your distraction with the anxiety. And so we're going to talk a little bit more about some sequences that can be used for anxiety, for example. And what we're going to talk about, I want to take a quick peek. On the screen in front of you, you see some of the common wellness and counseling issues that EFT can be used for. As I said, anxiety and depression, stress, PTSD, trauma, pain, weight loss, smoking cessation, drinking cessation, performance enhancement, are all examples of the ways that we can treat. So maybe we'll use anxiety. We'll stick with anxiety because I think it's something in the current times that we live in that a lot of us struggle with. And so we're going to say right now that I am safe and relaxed. Even though I am feeling anxious, I deeply and completely accept myself. That is our setup statement, and we're going to use that setup statement when we begin the session. We'll begin with the karate chop point. So we'll take a couple breaths and just kind of notice where the anxiety is, maybe where you're holding it in your body. For some of it's between our shoulder blades. That is for me. Or it might cause you a tension headache. It might be a knot in your stomach. Just kind of notice that gently. And then we're going to begin with the karate chop point. And we're going to say, even though I am feeling anxious, I deeply and completely accept myself. Go ahead and do it with me. Even though I'm feeling anxious, I deeply and completely accept myself. Now, it occurs to me that when I'm tapping on my head because I have a headset on, that this might be a little bit noisy, so I'm going to go gently to the top of the head. This anxiety is just a feeling. To the eyebrow point, I choose to let go of this anxiety. To the side of the eye, I am safe. Under the nose, I am loved. To the chin, I am enough. The collarbone, I am worthy. Under the arm, I forgive myself for feeling anxious. Now, again, there's other variations that we can use, and I'm going to go through one of those variations with you in this example. We'll do depression for this example, because EFT can be used to improve your mood, to reduce symptoms of depression like sadness and hopelessness and fatigue. And to use EFT for depression, you focus on the specific emotions that you're experiencing, or on the negative thoughts that you're having about yourself. So in this, you're going to notice in this sequence, I'm going to add an additional point. This is my personal preference that for when using EFT. But again, like I said, some people do the solar plexus point as well, or put their hands over their solar plexus and make a restatement of the setup statement, or they do the reversal at that point. I'm going to add an additional tapping point this time, and we'll use depression. So our setup statement will be, even though I'm feeling depressed, I deeply and completely accept myself. Our reminder phrase could be, I am worthy of love and happiness. All right. So again, we're going to start with the karate chop point. Even though I am feeling depressed, I deeply and completely accept myself. Top of the head, this depression is just a feeling. Eyebrow point, I choose to let go of this depression. On the side of the eye, I am worthy of love and happiness. Under the eye, I am loved. Under the nose, I am worthy. At the chin, I am enough. The collarbone, I forgive myself for feeling depressed. And underneath the arm, I release these heavy feelings that no longer serve me now. Okay, you can see that by taking a few deep cleansing breaths and recognizing where that feeling, where that emotion that you're working on is residing, whether it's coming down. We may do it again another couple of times, and if we're dealing with stress, for example, and its associated symptoms like muscle tension and headaches and stomach problems. Like I said, you can focus on the specific sensations that you're experiencing or on the stressful thoughts, but notice where you're holding that stress. Now, I want to make a clarification of intention here, and that is that we are not suggesting that EFT cures anything. We're not in the habit of diagnosing or prescribing or making curative claims for any kind of condition. But it makes sense to me that if we can do something that allows the body to respond, the body is an incredible machine that knows exactly what it needs to do to restore balance, what we call homeostasis. And so if you give the body the tools that it needs, it just makes sense that the body's going to begin to heal itself. So when we're talking about trauma, EFT can be used to heal trauma, post-traumatic stress, trauma responses, to reduce the symptoms like flashbacks and nightmares and intense anxiety. But to use EFT for trauma, it's important to work with a qualified EFT therapist, and it is preferable that you work with someone who has experience in trauma work itself, in releasing the energy blockages that are specific to trauma. So if this is something you're new at and you don't have a mental health background, then I recommend that you refer this out to somebody who does have that background, who is an EFT practitioner as well, because you don't want to bring up issues and causes and conditions that could spiral, which is one of the reasons why I don't recommend sort of the pop culture tapping that you see all over the internet, because that can actually make things worse. You can use this to alleviate any type of pain, any type of suffering, and we'll talk about in our advanced course some of the reasons why those sorts of issues, like weight control issues, chronic pain, fatigue, why some of those things aren't always just physical. That we have to release the energetic and metaphysical, mental, emotional causes of the blockages in the body, so that the body can begin to heal itself. This is used very effectively for improving athletic performance. I would like to suggest something that the founder of EFT, Gary Craig, said in one of the first workshops that I attended. He mentioned the fact that it doesn't even make sense when we say that such and such an athlete is having a performance slump. Performance slumps are not logical. If you've mastered the skill to be a top performing athlete, then your performance should always be high. If it's not, there's a blockage there. There's a short circuit that we need to let go of or refine. And so that's the approach. I love that example because that approach can be applied to anxiety and stress and depression. Certain forms of religious trauma, and so this is really a very effective and as I said in the beginning, non-invasive way to help folks. So, there have been case studies and there are ethical considerations, as I mentioned, when we're talking about EFT. This is a mind body healing technique that combines, in a clinical setting, the elements of cognitive therapy and acupressure. It can be used to help with a variety of issues, as I said, but it's based on the idea that our emotions are connected to our body's energy system. When we experience negative emotions like anxiety or stress or trauma, blockages occur, short circuits occur, whatever metaphor you want to use. EFT uses gentle tapping on specific points of the body to release those blockages and restore balance to the body's energy system. It allows us, and so many times we think about stress, and we think stress is a head issue, but when you think about it, when you're really stressed, your stomach's in knots. And so that's the place where your body produces the majority of serotonin, is in the gut. And so there is this axis, we call it the gut brain axis, that goes between your gut and your brain, that controls all of the body's functions by controlling the balance, the homeostasis, the sort of the natural state of ease that we were designed to experience in our lives. So one of the reasons that I think that this approach is well suited for clinical use is because it's non-invasive. As I said in the beginning, it's easy to learn. Even our advanced course, while diving much more deeply into specifics, allows you to have a better set of tools to work with. So that we're not relying strictly on medication, we're not relying strictly on traditional psychotherapy. For anxiety, EFT can reduce symptoms like racing thoughts and sweating, shortness of breath. It can be used to help clients manage their anxiety disorders like general anxiety disorder or social anxiety disorder or panic disorder, by giving them tools that they can use not just in a session with you, but when they're feeling that anxiety in everyday life. Likewise for depression. You can help clients improve their mood, reduce symptoms of depression like sadness and hopelessness, and elevate their sense of well-being so that fatigue is no longer an issue. But they can also use this on a daily basis. And clinically, studies prove that there's a 40% reduction, I believe, is the current statistics. Over a 40% reduction in cortisol levels after consistently applying EFT. So that says everything we need to know about using it for stress. And for mental health professionals, as I said, this is one of the most incredible tools I've ever used to help clients heal from trauma, religious trauma, sexual abuse, other childhood traumas. It's a powerful tool to use in helping somebody deal with flashbacks and nightmares and anxiety. These are results and outcomes that you don't see in the pop culture tapping approach. That things like PTSD and CPTSD, can benefit tremendously. And in addition to all of these examples, EFT can be used to address pain management, weight loss, smoking cessation, alcoholism, performance enhancement, like I said, for athletes or business professionals, and relationship problems. I have a client that I just saw this afternoon who's using EFT as a means of sharpening his focus and skill set as a realtor. So performance enhancement is certainly something that they've been seeing in their practice. This was, I think, their third or fourth session with us. So they're seeing an improvement in their skill set. Now, again, this is not, this is not a panacea. This is a tool. It's a tool that we use to open the energy blockages so that our bodies, our minds, our souls get the balance that they need to be able to do the things that they do. So we get the better ideas. We're more aware of opportunities when we see them. We're more mindful of our breathing and our posture and everything else. Now, I want to just sort of end this out on recognition of some of the important tools or tips, I would say, to keep in your skill set when using EFT. First, you want to start slowly. It's important to start with clients who are, especially when you're starting with clients who are new to EFT, to start with teaching them the basic EFT tapping technique and then begin to develop a sequence for a specific issue. And so I encourage you to do the same thing. It's the reason we don't just offer the advanced training right off the bat. We ask that someone take this free introductory webinar so that we can be sure that they have the opportunity to start slowly. And then we recommend that they don't start the advanced course until they've been using EFT themselves in this basic recipe model for about 30 days. Give yourself an opportunity to see some of the things that it does for you in your work. And then when you're using this with clients, and you can certainly begin working with clients and patients with the basic recipe, be supportive. Encourage those who are using EFT, check in on them, and let them know it's normal to feel some resistance. I am one of the most skeptical people out there. And the first 3 times I was introduced to this, I would never try it for myself because I just thought it sounded like New Age BS. Use your clinical skills. EFT is a powerful tool, but it's important to use it in conjunction with your clinical skills. It's not a replacement for traditional psychotherapy. So use that and use the skills that you have in being a critical thinker to notice the things that change when you use this technique for your clients or for yourself. If you're a mental health professional, I encourage you to learn more about EFT and consider using it as an adjunct tool in your practice. It's invaluable, and there are certain situations, certain conditions that we talk about in the advanced course where you do not have to use the some of the traditional models, some of the more invasive models. Um, to in treating that patient. You can tailor the tapping sequence to the client. You can incorporate visualization techniques with them or somatic approaches. You can encourage clients to practice EFT at home by giving them a sort of pared down, very simple practice. And we one of the things we do in the advanced course is give you handouts that you can use when you're doing this. So I really hope that that's helpful for you. On the screen in front of you is some recommended reading, and you can reach out to me if you would like to know more about the advanced courses, or if you want to schedule a session with me. You can go to mentalwellnessmovement.org, and there's an opportunity for you to reach out to me there. Now, I recommend as probably 3 of the most basic books, and I apologize that I don't have them sitting on my desk. They're in the other room where I was making notes about what I was going to say today. But the Emotional Freedom Technique Handbook by the founder and creator of EFT, Gary Craig, would be the first place I would start. EFT for Stress, Anxiety, and Depression by Carolyn Leaf. and The Tapping Solution by Sarah Payton. Those are three really good resources to help you get started. I'm sure that you have some questions. My hope was to be able to present this to you, not to give you all the answers, but to stimulate better questions. So now your questions can come in at a higher level. They can be more specific, and they can be things that particularly will matter to you and your practice. Whether your clients or patients are going to immediately embrace this sort of holistic approach is up to you. But we can support you, and we can help you and encourage you and empower you with the tools that you need to be able to make a more informed choice. So I hope this has been helpful for you. Like I said, I apologize for the moments when my eyes look all over the screen. I'm just trying to look away from the really bright screen. I was not thinking when I chose a white background for these slides, but I hope it's been helpful for you. And if you have any questions, just reach out to me. Again, you can reach me through mentalwellnessmovement.org. This is Dr. John Michael Salvato wishing you well, and I'll talk to you soon.